Highs of 75 today, 80% chance for showers. You heard Peyton Malone earlier say that it's going to be cold come Monday night, Tuesday morning, and a 40% chance for wintry precipitation. I think meteorologists are hesitant to use the S word, snow, but that'd be kind of cool, I guess. Dr. B joins us now. Dr. Brent Wallis, our friend, our guest, Chief Medical Officer of People's Health, to talk about senior health. Good morning, Dr. B. How are you?
Hey, Tommy, I'm doing good. How about you?
I'm good. I like it when it snows here, but we all know it can be disruptive. So,
oh, yeah, I don't know that I'm looking too forward to that.
Yeah,
Let's hope not.
Yeah, a lot of people are looking forward to their vaccines. I was talking to somebody yesterday that has some interesting political views, but yet they put that aside when it was their time to get the vaccine, and I'm glad for that. Vaccines are a hot topic right now, and with the COVID-19 vaccines being rolled out to certain groups, everybody wants to know, can I get it? Do I need to be vaccinated? Why are the vaccines so important? And then there are some scams out there as well. So, Dr. B, you got our time and our interest, and I know you're going to answer a lot of the questions and talk about how to spot and avoid a vaccine scam. So I guess the first thing is, again, going back to this friend that had a concern about the vaccine until it was his time to get it, then all of a sudden he jumped in line very quickly, which I'm glad. Well, what do you say to somebody who says vaccines are unsafe?
Yeah, Tommy, we hear that a lot, and it is not true. You know, vaccines have been around for 100 years, and they're very safe. There's a very rigorous process that the FDA goes through, using all of their scientists and medical professionals to really evaluate all the information that's provided to them from the vaccine manufacturers. We do trials, track any sort of adverse events that happen from the vaccines. And in general, they're extremely safe. So, I encourage people to ask their doctor those questions if they've got those concerns, but it's not really something that you need to worry about. With the COVID-19 vaccine, there's been a little bit of concern because of the speed of which it was released, but a lot of the back-end work had been done prior to COVID even existing. A lot of the technology had been done, and so no steps were skipped. Clinical trials were very robust, and the data looked very good. So those vaccines, just like the others that are available, are very safe.
What would you say to people that and boy, when it comes to vaccines, I hate when politics gets involved with science, but they say that the diseases that the vaccines prevent are no longer a threat.
Yeah, we hear that too, and actually some of why people think that is because vaccines are so effective. But the problem is that really if you didn't have the vaccines, those diseases would be much more prevalent in the U.S. A lot of the diseases that we vaccinate for, really we still do see on an annual basis. Things like whooping cough, obviously influenza, hepatitis, meningitis. All of those things cause real serious illness and sometimes even death, and they're still around. We diagnose them every year. For COVID-19, it's really important to remember that what we're trying to do is we're trying to end the pandemic and get back to normal life. And COVID is actually the leading cause of death in the United States. There's been over 9,000 Louisianans who have died this year and last year. And so really getting your vaccine is important to try to stop that trend and actually allow us to get back to a little bit of normalcy.
We were talking about this earlier. One of my big pet peeves are people that walk around the gym and won't wear a mask. And I caught somebody the other day when I was there, like in between the two of them yelling at each other. Poor lady was wearing a mask, doing everything she was supposed to do. We're going to reach herd immunity one way or the other. We can either do it through vaccinations and people, I guess we're back to flattening the curve here, or if you choose not to do any of this, a lot of people are going to die, but you can do it the easy way, you can do it the hard way, Doc, is what I'm trying to say, right?
Yeah, and I think it's very important to remember, wearing a mask is not that difficult. I know it may be uncomfortable for some people, but it's really been shown to be one of the most effective ways to prevent the spread of the disease. And so we really just need to do it while we're vaccinating people so that we can really get to that herd immunity.
Of course, some people say I don't want to get a vaccine. Every time I do, I get sick, whether that's real or imagined or not. That's a myth, is it not, that you're going to get sick?
Yeah, it definitely is. Vaccines definitely do cause different reactions in different people, and that's actually a good thing. It means it's working. What the vaccines are designed to do is introduce something into your body that basically tricks your immune system into thinking that there's something there that it needs to produce antibodies against, so that you've got protection in case you actually do encounter the disease. And so in that immune process of building your antibodies, sometimes there's some mild side effects. There can be a little headache, definitely a sore arm. Occasionally we'll even see some low-grade fevers, but those usually go away very quickly. And like I said, it's really a sign that the vaccine is doing what it's supposed to do.
So you mentioned like whooping cough and however you say it and other things before. What vaccines do we need in addition to when we're able to get this COVID-19 vaccine?
Sure. A lot of people think, I got vaccinated when I'm a child, and so I don't need any anymore. But that's not true. There's a lot of vaccines that actually require boosters, and then there's some that are very specific to adulthood, things that really you do need to talk to your doctor, because some of them are recommended when you have certain chronic medical problems. They can really give you a list of shots that are important for you. For people that are over the age of 65, though, in particular, tetanus and diphtheria, we always boost people for that. Shingles is extremely important. If you've ever had shingles, you do not want to get that, and we can now prevent that with a vaccine. Obviously, flu every year when it's available. And then the pneumonia shot is very important to really prevent not necessarily getting pneumonia, but actually having major consequence or even death from pneumonia.
All right, let me take a quick break. When we come back, we'll talk about some of the other objections. Sometimes people say it's not 100% effective. Why should I get it? And we'll also talk about the COVID-19 vaccine in Louisiana and who can get it and some other details. So very important information from Dr. B here. He's the Chief Medical Officer of People's Health, and we love having him on every Thursday morning to get the information out there and talk about senior health. 8:20, time for traffic now, WWL. 8:24 and a half, Tommy Tucker. Quickly back to Dr. B, our friend, Dr. Brent Wallis, Chief Medical Officer of People's Health, talking about senior health, specifically today about vaccines. So, Dr. B, getting back to it, people, that maybe look for any excuse not to get an injection, they say, well, why should I get a vaccine even if it's not 100% effective?
Sure. Yeah. It is true that vaccines are usually not effective 100% of the time, but that doesn't mean you should skip it completely. Almost all vaccines can prevent disease about 80 to 90% of the time. So it's really the best way to avoid catching one of these vaccine-preventable diseases. And the other nice thing about vaccines is quite often they can actually prevent you from getting more severe disease, the type of disease that may cause you to end up in the hospital or even to die. So even without being 100% effective, they do convey some serious protection.
So let's talk about the COVID-19 vaccine here in Louisiana. A lot of people confused about who can get it, when they can get it, how, etc. Doc, walk us through that, if you will, please.
Sure. We have a wonderful resource in the Louisiana Department of Health. They've set up a great website that really outlines a whole lot of information, both for your providers, the doctors that you're seeing, but then also for patients directly. And what they show you is where you can get the vaccine and who's eligible. And what's key right now is that, unfortunately, the demand is much higher than the supply of vaccine that we have, and we're slowly starting to see that change, and I think it'll continue to get better over the next couple of weeks and months. But right now, there is a limitation on the eligibility to patients that are 65 years and older. That actually started just this past Monday. We dropped from 70 years down to 65. And then, of course, we're vaccinating medical professionals, first responders, police and firefighters, and a couple of other groups that are in that eligibility. You can really see all of the details at that LDH website that outlines specifically what to do. The best place to get it is probably either at a local pharmacy or at your doctor's office, and you need to see if your doctor has it. The storage requirements sometimes are tough, and so some clinics haven't been able to keep it. but there are quite a few in the New Orleans area and actually throughout the state. Community health centers and FQHCs and hospital-based systems that are offering the shot directly. But remember to make an appointment. You usually can't just show up someplace to get it. And I'll say one other thing too, because people are putting their names on lots of lists to try to get shots. If you do get your shot somewhere, make sure you call back those places to take your name off the list so that someone else can put theirs on and they can get their vaccine.
And People's Health members, it's what? You had no cost sharing? It's free?
Yeah, there's absolutely no cost share for the shot at all for People's Health members, so that's great. There's no reason to not get it related to finances.
All right, talk about the scams that are going around.
Yeah, I mean, unfortunately, we see this all the time, and the COVID-19 vaccine is no different. There's been a lot of reports lately of some scams that are developing around COVID-19, and it's really because of the demand that people have for it. So keep in mind that you should never be asked to pay any money out of pocket to get the vaccine. The vaccines are being provided free of charge by the federal government, so nobody should ask you for that. And they also shouldn't ask you to pay to get on a waiting list. We've seen that happen. You don't have to pay to get early access. You just need to get on the list. And then another one that's particularly bad is some people are being asked for their Social Security number or a bank account or a credit card number. No clinic or pharmacy is going to ask you that in order to schedule you for a shot. So kind of keep an eye out for that. And if anybody calls you saying, hey, I can come to your house or I can ship you the vaccine if you pay for it, that doesn't exist. You really can't get it through the mail. So be aware anybody who's calling you on the phone about that. Those are all scams.
And if people are hearing this a little bit too late, what can they do? What recourse do they have if they have become a victim of this?
Yeah, there's a couple of hotlines that you can call. The Health and Human Services hotline, which is 1-800-HHS-TIPS. You can actually call CMS or Medicare directly at 1-800-MEDICARE.
And final word of advice, wrap it all up with the listeners about vaccines. Some final thoughts?
Yeah, I think the thing to remember, like we discussed, Tommy, is that vaccines are very safe and they're very effective and they can prevent you and your loved ones from getting really sick. So when you talk to your doctor, ask them, are your vaccinations up to date? Is there anything you should be getting? And definitely have a discussion with them about COVID-19 vaccine and determine if you're eligible and where you can get it. Like I said, watch out for these scams because they're definitely around and we don't want people to get taken by those.
Very helpful, great information. Thank you, Doc. We'll talk to you next week.
Thanks, Tommy. Have a great weekend.
You too, sir. If you want to know more, you can find out more about People's Health by going to peopleshealth.com/radio. You can call 1-866-687-7335, or you can follow People's Health on Facebook, Twitter, and Instagram. Taking a break now, WWL First News. For that, we go to Dave Cohen.